Today, we're diving into a really common but often misunderstood condition that affects a lot of our smaller dogs, tracheal collapse. In this explainer, we're going to break down what it is, which dogs are most at risk, and how it's managed, all based on what veterinarians see in the clinic every day.
It's such a specific and kind of startling sound, right? If you've been around little dogs, especially when they get all worked up and excited, you've probably heard this exact noise and thought, what on earth was that? You know, that's not just some funny nickname. That goose honk cough is the absolute classic telltale sign of tracheal collapse. It's so distinctive that for a vet, hearing it is the first huge clue that this might be what they're dealing with.
Okay, so what is actually going on inside a dog's throat to make a sound like that? To get it, we really have to look at the anatomy and understand what's collapsing.
So, the best way to picture your dog's trachea or windpipe is to think of a flexible vacuum cleaner hose. Its main job is to be a sturdy, open tunnel for air to get to the lungs. And to keep it from kinking or closing up, it has these little C-shaped rings of cartilage all along it for support.
And here's where things go wrong. In a healthy windpipe, those C-shaped rings are strong and hold the airway wide open, so breathing is easy. But with tracheal collapse, that cartilage gets weak. It loses its nice firm C-shape and starts to flatten out. As it flattens, the soft part on top starts to sag down, right into the airway, creating a blockage. And that blockage is what messes with the airflow and triggers that crazy honking cough.
You know, there's a medical name for this weakening of the cartilage. It's called tracheomalacia. And what's really crucial to understand is that this is a progressive condition. That means it can get worse over time as the cartilage gets weaker, which is why catching it and managing it early is so incredibly important.
All right, now that we've got the what, let's talk about the who and how bad. We'll get into who's most likely to be affected, what things can trigger a coughing fit, and how vets actually grade how severe the collapse is.
So when it comes to risk, the patterns are pretty clear. This is most definitely a small dog problem. We see it all the time in toy and small breeds. Think Yorkies, Pomeranians, Poodles, Chihuahuas. It usually shows up when they're middle-aged or older. But beyond genetics, a few other things can really raise the risk. Extra weight puts more pressure on their airway, and being around irritants like smoke can cause inflammation that just makes the whole situation worse.
And this is a big one for owners, knowing what triggers the cough. A coughing fit can pop up when a dog gets super excited or stressed. A huge one is any kind of pulling on a neck collar. But even simple things like eating, drinking, or being out in hot, humid weather can set it off. Intense exercise, too.
You know, vets have a system for this. They don't just say a trachea is collapsed, they grade it on a scale of 1 to 4. So a grade I collapse means the airway is blocked by about 25%. Then you get to grade 2, where it's about halfway closed. By grade 3, we're talking a serious 75% obstruction. And grade 4, well, that's a nearly total collapse of the airway. And this grading system is so important because it tells the vet exactly what they're up against and helps decide the best way to treat it.
Okay, so your vet suspects tracheal collapse. How do they actually prove it? Well, it's kind of like a step-by-step investigation, and they usually start with the simplest things first.
It usually starts right there in the exam room. A lot of the time, all a vet has to do is gently feel the dog's neck, and that alone will trigger that classic goose honk cough. Next up, you've got your x-rays. They give a still picture, a single moment in time. Sometimes you can see the collapse, and it's also great for ruling out other issues like heart problems. But to really see what's happening in real time, vets use advanced imaging. One option is fluoroscopy. That's like a moving x-ray video that shows the trachea as the dog breathes. The other is endoscopy, where a tiny camera goes right inside the airway. And that's considered the gold standard for a reason.
So, once you have that diagnosis, what's next? Well, here's the really good news. For most dogs, this condition can be managed super effectively and often without ever having to think about surgery.
This is such a hopeful number, up to 70%. Think about that. That means for the vast majority of dogs, this whole thing can be handled really, really well with just a combination of medicine and some simple changes you can make at home. It tells us that surgery is not the first answer. And a huge part of that success comes down to what you do at home. This is where you, as the owner, can make a massive difference. The number one
absolutely most critical change is switching from a neck collar to a body harness. It takes all that direct pressure off the throat. Getting your dog to a healthy weight is also key, and so is keeping the air they breathe clean, so avoiding smoke, strong perfumes, and a lot of dust.
Now, on the medical side, vets have a few tools in their toolbox. Cough suppressants are essential, because you have to break that vicious cycle where the cough causes irritation, which just makes them cough more. Anti-inflammatories can reduce swelling in the airway. Bronchodilators help open up the smaller airways further down in the lungs, and sometimes sedatives are used to help calm a dog down during a really severe, scary coughing fit.
But what about those other cases? For dogs with a really severe collapse or the ones who just don't get better with medical management, that's when surgery comes into the conversation.
Let's be really clear about this. Surgery is not the go-to answer. It's really reserved for the most severe cases, usually those grade 3 or 4 dogs, where the medication and home care just aren't enough to give them a good quality of life anymore.
So what are the options? Well, there are two main approaches. The first is to place these little plastic rings around the outside of the trachea to basically prop it up. This works best for a collapse that's happening in the neck. The other option is a stent. That's a mesh tube that goes inside the trachea, expands, and holds the airway open from within. This is usually the choice for a collapse that's happening deep inside the chest.
So when you zoom out and look at the whole journey for a dog with this condition, you see a pretty clear path. It all starts with getting that solid diagnosis from the vet. Then you move into that initial management phase with lifestyle changes and medication. After that, it's all about long-term care, just keeping an eye on things and making adjustments as you go. And only for that small group of really severe cases does the path potentially lead to surgery down the line.
Now, before we wrap up, this is really important to say. Everything we've talked about here is for educational purposes. It is absolutely not a substitute for professional veterinary advice. If you are worried about your pet's health at all, your very first step should always be to talk to your veterinarian.
So we'll leave you with this thought. A cough isn't always just a cough. Being proactive and paying attention is everything. It's all about listening to what your pet's body might be telling you and then working with your vet to make sure they have the happiest, healthiest life possible.